Here is the latest legislative news from the Texas Hospital Association, April 24th, 2023. In today's polarized political climate, few issues at the state level in Texas are more bipartisan than extending health insurance coverage for new mothers. It's been a priority for THA for years and also has the support of legislative power players, including Governor Greg Abbott and House Speaker Dade Phelan. That widely acknowledged need took a major step toward realization Friday when House Bill 12 by Representative Tony Rose passed the full House of Representatives. House Bill 12 would grant new mothers enrolled in Medicaid 12 months of coverage postpartum instead of the current 2 months. Data has consistently shown that many maternal complications and deaths occur after the current 2-month coverage cutoff point. Friday's 132-8 vote sends the bill to the Senate. On the heels of that big win, THA may soon see one of its highest priority bills become the first one to earn approval by both chambers of the legislature during this session. Senate Bill 240 by Senator Donna Campbell, a bill aimed at preventing workplace violence, passed the House last Tuesday with amendments. That means the bill must head back to the Senate for concurrence on those amendments. Once that happens, it'll head to Governor Abbott's desk. Senate Bill 240, as well as its companion, House Bill 112 by Representative Donna Howard, would require hospitals to maintain a workplace violence prevention committee and provide training on workplace violence at least annually. It would also prohibit retaliation or discipline for reporting an incident in good faith. THA also saw encouraging advancements on a key behavioral health measure to protect patients experiencing a psychiatric crisis. Senate Bill 1433 by Senator Juan Chuy Hinojosa, which would ensure physicians can apply electronically for emergency detention orders across the state, was voted out of the Senate Committee on Criminal Justice, then recommended for the Senate's local and uncontested calendar. That effectively sets up Senate Bill 1433 for a rubber stamp vote by the full Senate. Two highlights of THA's week included a lack of advancement on legislation that would collectively depress hospital payments, incentivize patients to be uninsured, and force clinics all over Texas to close, severely decreasing access to care. House Bill 633 by Representative James Frank failed to earn enough favorable votes to advance out of the House Select Committee on Healthcare Reform on Thursday morning. That bill would force hospitals to adhere to a government-set maximum payment rate for all services not provided under insurance, tied to that hospital's lowest contracted rate with any health insurer. THA is opposed to any sort of government rate setting in the private market, and under House Bill 633, patients would be able to obtain the lowest payment rate simply by not being insured. That bill stalling was a major win of the moment for THA, and so was inactivity Wednesday on the latest version of Senate Bill 1275 by Senator Kelly Hancock, which remained pending in the Senate Health and Human Services Committee. Senate Bill 1275 was previously one of two bills which targeted a ban on hospital outpatient payments, drawing fervent advocacy from THA in opposition. The latest version of Senate Bill 1275 attempts to ban all hospital facility fees for telemedicine or telehealth services, whether inpatient or outpatient. Telehealth is an increasingly crucial component of access to care across Texas. Prohibiting reimbursement would take Texas healthcare backward. Not all THA-opposed legislation stalled, however. The Senate Health and Human Services Committee gave a favorable vote Thursday to Senate Bill 490 by Senator Brian Hughes, despite opposing written testimony from THA. Senate Bill 490 would require hospitals to present an itemized bill to patients with any request for payment. THA's written testimony from Assistant General Counsel Heather De La Garza said meeting the requirement would be costly for hospitals and confusing to patients. Among other major bills THA opposed last week was House Bill 2017 by Representative Tom Oliver's son, which would generally allow health insurers to seek a waiver from any insurance law, regulation, or requirement if the insurer believes it would stifle innovation. The state insurance commissioner would unilaterally decide whether the waiver would be granted. THA submitted written testimony noting the bill would give the commissioner unprecedented discretion and would erode the state's gains in offering robust health insurance coverage and consumer protections. Join us again next week for more updates from the 2023 session of the Texas Legislature.